Hello everyone, this is Shadi Reis from ARCH 2023. I'm really privileged today to be with Dr. David Rizik, who is the chair of the Life Cases and Structure track at ARCH. Dr. Rizik, always nice to see you.
Always nice to see you, Shadi.
So, phenomenal life cases,
beautiful.
broadcast from everywhere.
Beautiful.
So, these life cases, I don't think they should stop. So, what is the educational value, in your opinion?
You know, we always debate taped cases versus live cases, but the on-the-fly decision-making and the type of decisions that you have to make extemporaneously with live cases is invaluable. It's irreplaceable. And when you see the type of live cases that the ARCH faculty and the ARCH live case operators have put on, I think the value, especially to fellows and early career interventional cardiologists, it's invaluable. There's nothing like it.
From access to approach, imaging, wet wires, wet ballooning.
And what happens when things don't go exactly like you had choreographed or exactly like you had planned? When you go through those decision algorithms, young, early career interventional cardiologists and fellows get a great educational value from these.
I don't mean to put you in the spot, but when I ask you a question, you always ask the panel for opinion of what to do next. What is the percentage of time the panel was agreeing or disagreeing, or they made you aware of something?
I love the disagreements. You know, there are many ways to skin a cat, as the expression goes, and I love the banter, I love the disagreements, and it does tell the viewer that there are many ways of doing this, and don't get stuck into only one way of treating, especially complications. So yesterday is a great example. There was a beautiful TAVR case, and there was some disagreement in the panel on which TAVR device to use, whether or not this patient was actually surgical rather than TAVR. I believe it's that back and forth banter that has the most educational value.
Absolutely. One of the phenomenal things I see at SIF as well when you broadcast is you're bringing awareness of radiation safety. And you presented to us the Portigo system about the radiation safety. So tell us about us, why you are so passionate about that.
You know, when you get to have been doing cases in the cath lab for 35 years, you understand the amount of radiation that you've been exposed to. I think that especially our early career interventional cardiologists and fellows, they don't think about radiation safety as much. When you get to be my age, you think of radiation safety, you think about the burdensome lead that you've been wearing and the back pain and the hip pain and the shoulder pain and all of the orthopedic maladies that go along with it. I think it is time that all of the societies, SCI, ACC, etc., take this on as a #1 priority. And I don't think radiation reduction is enough. I think the aspirational goal must be zero radiation to our operators. And if you think about it, you go in and do 2 or 3 cases in a day, but the nurses and the patient care technicians, they do 10 or 12 cases in the day. They're constantly rolling over the lab. Think about their radiation exposure. So it's not just about the primary operators, the physicians. It's about everyone in the lab, and the aspirational goal has to be zero radiation exposure to our operators and nurses.
So, and one of the things is about nurses, as you mentioned, most of the time they come to the patient head doing something, an IV or medication, and just getting blasted.
Absolutely. If you look at the data that we generated in our side-by-side comparison of standard protection to Protego, the levels, the radiation exposure to the operators in the Protego arm was minuscule. It was minuscule, and I believe the accompanying editorial in JSky even emphasized that this is the lowest radiation exposure of any trial ever. So, you know, we have the devices, we have the technology. The technologies will be in need of iteration, but what the technology is most in need of is SCI, ACC, and the other societies getting behind the aspirational goal of zero radiation.
Absolutely, and I will put for the audience the link for the paper that you published. Congratulations about radiation, so you can link in the description below. Dr. Rizik, thank you so much for being with us.
Thank you, Chadi.
Always a pleasure. Watch this
Congratulations.
Thank you, and watch these videos and others on ARCH YouTube channel. This is Shadi Reis from St. Louis. Thank you.